Dr. Li is awarded as an MD in 2008 from the National Defense Medical Center and completed his clinical training in reproductive medicine in 2016. And also he obtained PhD degree from Institute of Medicine, Chun-I Medical University. And his research focuses reproductive biology and application of artificial intelligence in fertility. And currently, Dr. Li is the CEO of the Women's Hospital, and also he's an associate professor at Institute of Medicine, Chun-I Medical University. And our second speaker, Dr. Keiichi Kato, is the general director at Kato Ladies Clinic in Tokyo. And Dr. Kato earned his MD and PhD degree from University of Kanazawa. His main research interests are natural cycle and minimal stimulation IVF to deliver safe, effective, and patient-friendly art. And many people will know his name from numerous publications he published in the art field. Let's move on to our first speaker today, Dr. Li. The title of his talk is Time-lapse, PGT-A, Clinical Application and Efficacy. Dr. Li, would you please share your screen?
Okay. Great. Okay. So, Dr. Kato, Chairman, ladies and gentlemen, I'm great honor to give the speech at the Vitrolife and the Igenomix online meeting. On behalf of the Women's Hospital, I'm delighted to welcome all of you to Taiwan. I'm the CEO of the Women's Hospital and Assistant Professor at Chun-I Medical University Hospital. There is no conflict of interest in this presentation. The subject I want to talk about is probability prediction by non-invasive embryo evaluation using time-lapse system. Okay. Traditionally, we use the appearance of an embryo to tell a good embryo from a bad one. Like other system, is a very good judgment tool. With the progress of the times, the methods of inspection have also been increasing. The invention of the pre-implantation genetic diagnosis testing is regarded as a good milestone in this field. We can not only distinguish the good from the bad from the appearance of the embryo, but also know whether the chromosome is abnormal or not from inside of the embryo, which greatly increases the possibility for us to select a good embryo. There are over many examples of normal PGS result but implantation failure. When adding the morphokinetic data by time-lapse machine is a normal way to help us to enhance the possibility to select the best embryo. Most human pre-implantation embryo display chromosome mosaic, with the most common pattern being euploid mosaic, where the embryo contains a complement of both normal and abnormal cells. Mosaic embryo is a gray area between good and bad embryos. So, is there a non-invasive way to know whether the embryo is aneuploidy or not? By using the time-lapse image data, Dr. Campbell created the algorithm using the time TSB, starting forming brazosis time, and the TB, we call the forming brazosis time. The algorithm could help us to know the risk of aneuploid embryo. This algorithm with TB and the TSB is not only prediction of embryo aneuploidy risk, but also prediction of fetal heartbeat or not. The chart with the left time to TSB and to TB show the high successful rate of fetal heartbeat. AOC of this prediction is 0.75. So, using this algorithm could help us to get more euploid embryo and have high pregnancy rate. Except the kinetic data, time-lapse machine acquire cleavage abnormality. Like we know, like a multi-nucleation, reverse cleavage, a DUC, ICT. Previous study mentioned dysmorphism of embryo could enhance the aneuploid rate. If there are more than 2 dysmorphisms, the euploid rate will drop to maybe the 27.6%. Our research before is based on the correlation between morphokinetic data and the chromosome status. Chromosome status included euploid, low-level mosaic, high-level mosaic, and aneuploid. Between high-level mosaic and euploid embryo, we can see that T5 and the T8 have a delay in high-level mosaic group. And we found that TB is delayed in aneuploid group. Between the time interval, like the chart right, we found the CC3, we call the time interval from T3 to T5. It's longer in high-level mosaic group, even compared with aneuploid group. Elongated cleavage time is a sign of mosaic. It indicates that the embryo may go wrong in mitosis phase. Our study also compares the division pattern and the chromosome status. Division patterns are including like the irregular division, multinucleation, and the developmental phases. In high-level mosaic group, multinucleation rate is higher than euploid group. It implies that if the embryo has high percentage of multinucleation in 2-cell or 4-cell, this embryo has high possibility to be a high-level mosaic group. It also indicates that aneuploid group has lower developmental path. Like we can see, the Brussels cyst 4BB formation rate after 120 hours is lower in this group. So this study combined with patient factor, morphokinetic data, dysmorphism morphology. We want to find the correlation within this data. So we not only analyze euploid and aneuploid, but also low mosaic and high mosaic embryo together. Evaluate multiple parameters using time-lapse combined with NGS to see whether is this the difference between the patient factor or the morphological or morphokinetics of the embryo that affects the aneuploid level. The following topics are intended to understand how Brussels cyst formation correlate with the future of day 3 embryo observed with time-lapse system. The embryo feature we want to observe are perturbation. Now we must to know the Vitrolife T-score D3 model is mean. Vitrolife company provide this T-score D3 model for us to evaluate egg cell. We use this model by feature of D3 cell and predict pregnancy outcome. D3 model is scored on a scale from 0 to 5. A score of 0 indicates abnormal fertilization. So the embryo is abnormal fertilization. We also collect to score 0. And score of 1 and 2 indicate early stage cleavage abnormal. A score of 3 and 4 indicate day 2 to day 3 cleavage abnormal. A score of 5 indicate all criteria are passed. The higher the score, the higher the pregnancy rate of the embryo. We observe different features of day 3 during time-lapse system. Traditionally, the time we need to obtain this parameter is not the same. But by time-lapse video of embryos, we can confirm that we get our parameter at a fixed time, 66 hours. So that comparison will be more accurate. Like we can see like KIT score D3, cell numbers, division pattern, fragmentation proportion. Regardless of the age, as the KIT score D3 score decrease, the ratio of good embryo also decrease. The number of cells greater than 8 and the number of cells less than 8 are different in the number of euploid formed. This phenomenon is the same in symmetry and asymmetry pattern and in fragmentation. Using this parameter can help us to select euploid embryo in day 3. Which factor is related to euploid embryo? We use GEE to analyze each parameter. After running the multivariate analysis, I found that 3 lists, like the female age, KIT D3, cell number, symmetry, are all related to euploid embryo. But in fragmentation, it's not relevant. We use ROC curve for predict euploid rate. Using the female age, the AOC is 0.612. Use the KIT day 3 model, the AOC is 0.693. And use cell number, AOC is 0.664. Using the division pattern, AOC is 0.608. While combined with KIT score D3 score and D3 cell number and division pattern, the AOC is up to 0.724. So I think combine this parameter will help us to know the euploidity or not. We can see that if we choose the group KIT score day 3 score 5 over 8 cell and division pattern symmetry, we have higher rate to choose higher euploid embryo. But under 7 cells in 66 hours, even symmetry cell has the same euploid rate in a symmetry group. Multivariate GEE analysis demonstrate that maternal age, KIT score day 3 cell number, and the division pattern were associated with the formation probability of euploid blastocyst. ROC curve analysis revealed the combination of KIT day 3 score, D3 cell number, and the division pattern was competent to predict euploid, AOC area 0.724. Besides maternal age, we found that D3 embryo with KIT score D3 score 5 over 8 cells and a symmetry division at 66 HPI had increased euploid rate. The next topic is intended to understand how blastocyst formation correlates with the future of day 5 embryo observed with time-lapse system. The embryo feature we want to observe are per blastocyst. And these 2 studies is based on the patient fact together. So using time-lapse could help us to clearly know the different co-founder, like morphological dysmorphism, DD, DC, RC, ICD, MN2, MN4. And the morphokinetics data parameter like TM, TSB, TB, TB to TM, TB to TSB, KIT score day 5. But most important, we combine the patient factor like male age, semen quality, female age, MH, BMI, or sign number, to see which factor influence the euploid rate. We apply the multiple variate GE analysis To see which factor related embryo mosaic level, we divide to three levels. Like one level is diploid aneuploid level under 20%, and diploid aneuploid level under 50%, and the diploid aneuploid level under 80%. We divide into these three groups. We found that female age, oocyte number, mature oocyte number, autologous oocyte with donor oocyte have high relationship with mosaic level. And we divide the traditional T-score day 5 into three groups for us to help us to calculate this data very quick. And we divide in the to see we have a grade A is originally scored 5 and 6. This group means reach blastocyst stage at 150 hours and the moderate or regular morphokinetic pattern during developmental with good TE and ICM grade. Grade B is scored 3 and 4. And this group means reach blastocyst stage at 150 hours and the moderate or irregular morphokinetic pattern during development with moderate TE ICM grade. Grade C is scored 1 and 2. This group didn't reach blastocyst stage at 150 hours. Using time-lapse to predict embryo ploidy are still controversial, but it's very still worth continue to study. All of the euploid embryo are concentrated in T-score day 5 in the old patient. Each kids group in the young population has a certain normal rate of PGS. We use univariate logic regression model to review correlation of T-score day 5 grade with mosaic level. In our study, we found that between grade A and grade C embryo, grade A embryo has higher potential to get low mosaic and the euploid embryo. But in other group, we couldn't find statistic significance. This chart uses T-score day 5 to predict ploidy states of embryo. The AOC in euploid, low mosaic with euploid and euploid are 0.529, 0.555, and 0.537. This chart let us know that we couldn't get good prediction of euploid rate if we only use T-score day 5 for evaluation. And we divide T-score day 5 for three groups, like I said before, grade A, grade B, and grade C. There's no statistical there's no difference in euploid group. We couldn't distinguish which is euploid embryo from the T-score day 5. In high-level mosaic and aneuploid group, there's a trend that grade A has the lower chance to have this embryo. Since it is impossible to know whether the ploidy status of embryo by T-score day 5 alone, so we try to use blastocyst morphokinetic pattern to analyze it. We use the feature of blastocyst formation and the blastocyst morphokinetic data like TM, TSB, TB, TB to TM, TB to TSB. We found that there's no correlation in euploid group. But in other two groups, this morphokinetic feature are found delayed in other two groups. It means that there maybe has some correlation between these features and the ploidy status. But this chart reveals that it is not good prediction tool to know the ploidy status of embryo. We couldn't find good prediction in this group. Whether using T-score day 5 or morphokinetic features together, the predict power is not very good. So we combine this morphomonism like DD, data division, DC, ICD, multi-nucleation 2-cell, multi-nucleation 4-cell to check correlation with polarity states of embryo. We found only the group of multi-nucleation in 4 cells has higher correlation with mosaic level over 80%. And all of this data are judged by patient factor, including patient age and age. And about the multi-nucleation 4-cell group, we found that there's no difference in urea rate within non-MN4, is we call the multi-nucleation 4 and the MN4 group. High-level mosaic rate is higher in the MN4 group than in non-MN4 group. So it's very tricky. Different from the traditional way, we define morphology in terms of time-lapse. We divide expansion to 3 levels. Level 1 means starting blastotation. Level 2 means starting expansion. Level 3 means starting herniating. That could help us to uniform the time points morphology parameter and help us to calculate which parameter influence most in polarity status. This graph compares the relevance of morphology parameter and polarity status. We found that expansion level is higher, the euploid rate is higher. This happened in the case of ICN and TE as well. We use the bar chart for analyze. Euploid rate is higher in expansion level 3 group than in expansion level 1 group. Euploid rate is also higher in inner cell mass grade A and the intrafectant grade A group. It means that we could also predict the euploid rate by morphology. This is our studies. Does we have another way to really predict the euploid rate? We published a paper in JARG on using time-lapse video to predict euploid rate. We set up a prediction model by combination with time-lapse video and the polarity states of embryo. This prediction model is designed by the technology of deep learning. We use 3D CNN for deep learning. All times video number is 619. All combined with PGT-A result. The data are all integrated with EMR. It helps us know the patient factor like the AMH, like the using protocol or others. By using this model combination with RGB and optical flow, we fuse this, and the prediction of aneuploidy rate, AUC, is up to 0.74. So using time-lapse evaluation, it's possible for us to understand underlying correlation between embryo features and the embryo polarity. Specifically, our study demonstrated that the embryo factor assessed at uniform time points on day 3 or day 5 were likely to correlate with the formation probability of euploid embryo. However, the predict power for individual parameter remain perfectible. Application of deep learning technology, the AI model, trained by time-lapse video, may be able to identify aneuploid blastocysts. Thank you, everyone. Thank you.
Thank you very much, Dr. Lee, for your excellent talk and detailed analysis between the time-lapse annotations, parameters, and quality of embryos. So there are a few questions now already posted. So I'm starting with the first question. Okay, first question. What are the differences between conventional and time-lapse based evaluations?
That's why we want to use a time-lapse system. Yeah. That's a very good question. The time-lapse system, it allows us to capture like the morphology features, and they give us to continuous observing the embryo status, like their growing, And continuous monitoring will help us to uniform. I call the time points. Okay, because in our study we need to know every time is the same. We can regulate the time points, and we can see, oh, it is truly the 66 hours like the morphology. Okay, so another thinking is that we use this more steady. Because if you use the convention, we cannot see this M image like that. So I think this is a difference about between the like conventional and time-lapse best relation.
Thank you very much. And second, let's take the second question. So what is the value for the time-lapse parameter for day 3 embryo for clinical use?
Okay. As I know, like many centers, we always use the day 5 Brussels seed to implantation. It's very normal. But why we started for the day 3? Because in our center we have many older patients, and maybe that's why that is the time that many patients marriage very in old time, old age. So we got patient like this. But this patient, we cannot get like so many embryos, like we want to do the day 5. Maybe they come first and they get nothing, come back. So we choose to survey the day 3 because of there is not very good embryo for us to do this. So we focus on how to choose a very good embryo from day 3, I say about use the morphokinetic data or morphology pattern, and help us to know which is best. And another way is that we don't want to put too many embryos, so we just to choose the best to put. That's why we still starting for day 3 embryo.
That's very important, especially that's kind of relevant message to Japan as well, where we also have quite the average age of patient is quite advanced in our nation as well. The third question is all of the morphology components were individually correlated with euclid rate in your presentation. How to rank the embryo objectively with using those components? Yes.
As we know, like the Brussels seed expansion, ICM, TE, in our study, they have influence the data. So I think if we combine this data, we will want to have a higher possibility to let us to get more accurate embryo. Yes. So in our center, we do like to combine two together. Traditionally, we use the K-score day 5 for our clinic for basic choice, and then we add our score to buy the morphokinetic the morphology data or other data to combine a new, we call the TLBMS. It's a score. But it's just for our center to use. Yes, we help the patient to get a good data, good embryo. Not only by we choose like the 2 systems to help us to select, but it's still progressing now. So I think if we want to rank embryo very good, I know actually Vitrolife has like the IDA score. So but I think there may be to like more time machine training or others to help the data more improvement. But before that, maybe I will try to find for maybe every center has their own choice or their own regulation others. So maybe train, but in the future, I think the IELTS score will be better. Yes, that's my thoughts.
Right. That's a good point. Each clinic has very unique situation, and that's actually probably the same common reason Dr. Kato's clinic also has his own evaluation system being used quite a long time, I heard. And that could be mentioned in Dr. Kato's talk, upcoming Dr. Kato's talk. So let's move on to Dr. Kato's talk in the second half of today's webinar.